So the substance abuse thing has actually been documented for years now, but they looked at 30 veterans with TBI or traumatic brain injury. And first thing they looked at is functioning. I had to look at the results repeatedly because it's not like a little bit better. And they're just like, okay, well, it's a little bit better, but it's statistically significantly better. Like it was just like eye popping, like, oh my God, like they're like doing a lot better from baseline.
And it's with a single treatment, right?
Yeah.
And it's
then
a
with
single
two treatments, single treatment, and then with the second treatment, it goes like
exponentially.
Yeah.
Compared to like, people get on methadone and stuff and you have to be on that. All it does is it gives you the same effects without the euphoria. Or the
exactly. But it has side effects
doesn't really do much.
With like bone density, losing your teeth, like you're just not a healthy person on methadone. But on top of like just the functional recovery after the TBI, stress, anxiety, depression took a nosedive after this treatment. Again, it's not like a little bit of improvement. It's like, it's so drastic. Like it needs to be like implemented pretty well. There should be organizations like the NFL, NHL, even boxing organizations that should be funding studies on this. Because it improves like a lot of neural pathways. It promotes white matter growth. It's been shown on like imaging. It goes like kind of in a trend of like what we've been seeing with like psychedelics or like psilocybin, even ketamine treatments, things that have been like shunned for a long time, where it's just like, just try it out. And like, even as a medical professional, like even if I see a family member suffering through this, I can't like be like, this thing might help you better than anything else I've seen might help you. But I have no way to do that or even try it out.
And like sometimes it's like the physicians that are trying this stuff out, they're like shunned and looked down upon, and like you almost can't carry like an MD behind your name because
you're risking board certification, like you
losing
you can
your
get
license
that revoked.
But like, these are the guys just making incredible ways for like people to heal. And with one of the biggest problems, well, multiple big problems, the whole psychiatric and behavioral health problems with something that's, I think, is pretty cheap to make. Psychiatric's part of that whole depression, but also like TBI and also the addiction stuff that's going on. So
it's huge. Just think addiction, depression, anxiety. Like if you get those three things, like even if you make a 10% dent on each one of those, it would make a huge difference. But like
there's only like 3 or 4 clinics in the world that actually are doing it. It's like not many, and it's something that definitely needs to get a push. I really believe in the psilocybin studies and MDMA studies that are, the microdosing, but this seems like it's at another level with the cure.
I'm willing to bet some people respond to things in different ways. And because like the brain is so complex, like it's not like one treatment for all, but each individual is going to respond differently to each thing. Like if you're monitored accordingly, you should be able to experiment and be like, oh, what works for me? Rather than like, okay, but it's what's going on anyways, right? Whoever's prescribing you medications, like, oh, you don't respond to this SSRI. Let's switch you over to this one. Let's switch you over to that one. But it's all like pharmaceutical grades.
It's being able to find the appropriate places, setting up the appropriate places to be able to, like we were working on a wellness center for the veterans ourselves. And like, this is something I hope that we could possibly add on with doing, but there's so many regulations with trying to get some of this stuff. But I would love to be able to do it.
If it wasn't for the career risk, we'd start this up tomorrow.
The thing it does is like, it's not just helping one person or a small group of people. We could have an ultimate effect on such a huge population.
Especially if it's like 2 treatments.
2
treatments gets to like 97% efficacy.
That's not what the pharmaceutical companies want to hear.